Hi, I'm Jane Zamorsky. I'm a social worker working in long-term care. My role as a social worker is one of assisting families and residents as well as staff and educating them. Today we will talk about community resources and support for families caring for loved ones with dementia. Caregiving provides both opportunities and challenges. It can be a very lonely and hard experience, especially dealing with loved ones who have dementia. Loved ones who were once vital family members now need assistance with bathing, dressing, and making meals. Many families do not know what to do to assist their aging spouses or parents. Their first step they may want to consider is talking to the family physician so they can get a diagnosis of the medical issue and have recommendations made about living environment. The next step would be to contact their local hospital or senior health center that may be located in the hospital to make further diagnosis or make referrals. They also may consider contacting the County Department of Aging or Senior Services to help them with finding resources available in the community with regards to assistance with bathing, dressing, and meals. They also may consider contacting a geriatric case manager who may be a nurse or a social worker who can help organize care at home. There are also many legal issues or elder care that needs to be considered to make sure that finances as well as medical documents are up to date and that care needs can be met. Support groups are also another wonderful opportunity which can be found at local hospitals as well as the Alzheimer's Association. Families can know that they are not alone with their struggles with dealing with care at home. Care at home. 80% of care is provided in the home. This provides many benefits. The care is personalized. They receive one-on-one attention from family. It can be inexpensive because family usually donates their time. It also provides a familiar environment that the elder is familiar with. It also provides an opportunity for family to learn to respect and share how to live. The challenges with care at home are that there are no national programs to fund care at home, which is an incentive to institutionalization. There's also stress in the family and also work demands if family members are working full-time. There's also dealing with the memory loss and behaviors related to the dementia. Sometimes families need to seek community resources which strangers now come into the home. And also there's a consideration of the caregiver's own health. Options for care. Respite care is provided in a nursing home or assisted living facility, which gives the caregiver a break from care for 1 or more days. Another option is adult daycare, which the caregiver drops off their loved one at the center and picks them up later in the day, which provides a break for during the daytime. These services are not always available and can be expensive. Another option for care is home health. This is usually either privately paid. There are very limited financial resources. There is the Community Options Program, which is a block grant program provided to the counties, and there is a long waiting list for that funding. Also, many families are dealing with caregiving from a distance. Family members are out of state and having to try to coordinate care at home can be very difficult. Nursing home placement is usually the final and last option. This is not an easy transition for people with dementia. Often their loved one has lived in a house or apartment and now has been reduced to living in one half of a room with a roommate that they may not even know. There's also the grieving and loss of control. It takes some time for them to adjust to their new environment and get to know the staff. They also are depending on strangers for care, which can be difficult due to staff changeovers. In most cases, family members have cared for the resident with dementia for months or years prior to admission to a long-term care facility. By the time a decision is made to admit the individual, the family has often been physically and emotionally drained. Admission is a traumatic experience. As you work with residents with dementia, please remember, family remembers the resident as a vital family member. Acknowledge the family's presence. A spouse of a resident may have no other support system. If they have children, they may be miles away. It can be very upsetting not to be recognized by a spouse of many years. Some facilities have support groups for families. Listen to family suggestions. They often know what will work and what will not be effective in caring for the new resident. Allow family members to participate in care if they choose and if it is appropriate. For example, many family members like to assist the resident at meal times. Caring for someone with dementia provides both challenges and opportunities. Families need special understanding and support of community services in order to provide quality care for their loved ones.